Hello, Southwestern Elementary School students. My name is Dr. Nick Shirey, and I'm a recent graduate of dental school, which I believe that makes me a dentist. A little bit about how I got involved in dentistry and became a dentist. I actually went to Hanover High School quite some time ago, and after high school, I went to college for 4 years and got to play football while I was there. I majored in biology, a science field, and after that I applied to dental school and got accepted. And dental school was 4 years. I just recently graduated. And throughout dental school, I actually joined the Navy just prior, and they paid for me to go to dental school. So now I will serve as a dentist in the Navy. So you may ask yourself, what am I doing now? What can I do now to learn the skills to become a good dentist down the road? Well, in fact, that's a great question. There are a lot of things you can do. A lot of things you are learning right now that will help you become not just a good dentist, but any field down the road. One of them is problem-solving skills. And with dentistry, a patient comes in and they say, Dr. Nick, I got a pain. My tooth hurts right here. And it's your job to put on your detective glasses and look in that patient's mouth and figure out why. Use problem-solving skills. Why are they in pain, and what can I do to help them? Another thing you're learning right now is math, learning how to add, subtract, multiply, divide. Well, how does that relate to dentistry? Well, in fact, this here is what we call a carpule of local anesthetic. Now, what's local anesthetic? What's that? What's that do? Well, actually, if you ever have a cavity filled in the past, doctor probably gave you one of these. This actually is a numbing solution. So it's a little injection, and then all of a sudden you're numb, and the dentist can work in your mouth, and you don't feel any pain. Why do you need to know math to use this? Well, there are actual maximum amounts that every patient can receive, and that's been tested with science. And how do you know how much each patient can receive? It's actually based on body weight. So there's a couple calculations. You're multiplying, you're dividing, and each patient can only receive a certain amount. Usually the smaller the patient is, the less local anesthetic they can receive. What other things are you learning now? Well, art. Art is a huge component of dentistry. And how is that? Well, dentistry is all about making someone look and feel good when they smile. So when someone smiles, you have to use your art skills to make a restoration, a filling, or a crown, I'll explain those later, look good when they smile. And how do you do that? Well, you use your art skills. Not only do you learn how to use your hands and how to paint right now, but eventually in dental school you learn how to wax teeth, how to drill on teeth, and then eventually you do it on patients. One of the other components is getting along well with others. I know a lot of you are great at that. Make a lot of friends in school right now. Well, dentistry is a big component of that as well, because you work with patients every single day. Not just your patients, but your staff and your fellow coworkers. Getting along with everyone is very important, because that makes the office flow smoothly, and the happier everybody is, the happier you are at the end of the day. Now, what do I like about dentistry? There's a lot, but I'll just give you a couple reasons for the sake of time. First thing is, you get to work with people every day. Now, you can ask my mom, Mrs. Shirey, how much I like to talk to people. And that's something I get to do every single day. I get to talk to patients and interact and learn about them and try and make them happy. And that is I think, the best thing about dentistry. What else? You get to be your own boss. And what do I mean by that? A lot of dentists own their own practice. And what does that mean? They set their own hours. They hire the people that they want to work with. And basically, you get to make all the decisions. Another nice component of dentistry is it's what we call a lifestyle profession. Now, what does that mean? Well, dentistry usually has pretty decent hours, and not too many dentists work a ridiculous length of time each week, which allows for a lot of dentists to have a decent amount of family time, and I don't think there are too many people that are going to complain about that. And the most important factor, I think, when people like to go into dentistry is that you get to make people smile. some people come in and they haven't smiled for a while. They aren't happy with the way they look. And you get to work on them over many different appointments, and in the end, when they see that final result and look in the mirror and they smile and they're just glowing and they're happy with the way they look, it sure is a great feeling. So now that I've told you a little bit about what makes being a dentist so neat, I'll try and show you a little bit about what we get to do. So sometimes with an elderly population, a patient may lose all their teeth over the years. And they come in, now these are stone, they come in and they don't have any teeth. How can they eat? Something like that. Well, one of the things we'll do is we'll make complete dentures. And basically a complete denture replaces all the teeth in a patient's mouth. And when they're done, they look kind of something like this. So you're able to take a patient, when they smile, no teeth, looks kind of something like that. So you take some impressions, do some lab work, about 6 different appointments, and they come back and you can have them looking just like that, smiling real big, being able to eat. Well, what if the patient's only missing one tooth? Well, we can do something that we call a bridge. Well, what does a bridge do? In the basic, simplest terms, a bridge spans from one land area to another over water a lot of times. So basically a bridge in dentistry spans from one tooth to another tooth over an area where there isn't one. And here's an example. If you look, so picture a patient smiling at you and they're missing one of these teeth right here. What we can do is called a crown preparation, where we basically shave a little bit of the tooth off in 360 degrees around. And that's a big component of dentistry and why you need to have good hand skills, because it's very tedious to take just maybe a millimeter off around the entire tooth. And that allows for us to put a crown around each tooth that's adjacent to the area that's missing, the edentulous space. And we send it to a lab, we take an impression, we use a gun that looks something like this, and it squirts out material. It's fun to see. Dentistry is fun. You get to play with a lot of really cool things. And you squirt this goo out, and it's real gooey right now, but it takes about 5 minutes, and it sets up in a patient's mouth, and then you pull it out, and it hardens up and looks something like this. And you can send this to the lab. The laboratory then makes something like this, and this is the end product. This is a bridge. This is a tooth right here that it goes over, a tooth right here, and then there's no tooth here, but it's replaced. So what does that look like at the end? Well, you go from something like this. This blue stuff on the teeth is just what we call a dye spacer. Just provides a little bit of thickness. The teeth really aren't blue. So then you can go from something like this to the lab comes back and gets you your crown, your bridge, and then the patient's able to smile and it looks like there's a tooth there, even though in reality there's not. So now I hope you're all sitting there thinking to yourselves that being a dentist just sounds like the coolest thing in the entire world. Well, let me tell you, it definitely is. And even if you're not, I have a message for anyone that wants to do anything down the road. So I'm speaking to everyone right now. What's the most important thing that you can do right now, whether you want to be a dentist or a businessman or a vet, anything at all? The most important thing that you can do is to do your best in school. Now, I'm really sorry I wasn't able to be there today, and I hope this video was able to shed a little bit of light onto what being a dentist is all about. But regardless, do your best in school, and someday maybe you'll be a dentist.